I actually was asked to do 2 roundtables this year, one on incorporating cardiovascular assessment package called Health Aware and how to connect the dots and to track and get a little bit of ROI into the HeartCaring program. With administration, since I'm out of the marketing department, I think it's a little more pertinent that you prove what your program is, because in the times that we're faced with now, programs are being cut left and right, so it's very important to prove that. HeartCaring to me, I think I've quoted before, has been a glass slipper for me. By trade, I'm a cardiovascular nurse for many years, so I've done everything on the clinical side. To be given HeartCaring kind of completes the circle for me, and it's a passion. I also have a positive family history. My mother had an MI at 51, so I think if it hits home, I think it gives you a little more power to go on every day, because sometimes you do feel alone when you get back home. I always get teased because every physician appointment that I go to personally ends up being work time rather than than health time. I still seize every opportunity. As far as being a physician liaison, I'm placed in the perfect position to very easily have those conversations. So it's pretty easy to get that information and get in the offices. I've had a waiting list. HeartCaring, once you develop the program and get the reputation where it needs to be, it comes to you. You don't have to seek it anymore. And I think we've heard that today. I mean, you're bombarded because it's so popular. It's a hot topic. Once everyone realizes that it's actually a service and there's no catch, it catches on like wildfire and there's no putting it out. With my program, I initially started and got CME attached to it. So that has been probably the most invaluable piece to them. It's free CME for not only them, but it's CEU'd for their staff as well. A lot of physician offices don't have the time or aren't connected with the hospital to obtain the CEU or CME, so that's a big selling point. Also the material's absolutely beautiful and it's very easy to use. And they wonder what the catch is. And once you prove that there is no catch, there are a lot of people knocking on the door. We're a small community hospital, so we can't offer PCI or surgery. So it's very nice to have something on the preventative end to kind of fill the gap. And I think the physicians, once they get the patient back, it gives them talking points to follow up with the patients and keep their attention as far as preventing anything further. Just because it was me that launched it, I may have been asked to launch it even though I wasn't HeartCaring, but it kind of probably got put in my lap for that reason. Health Aware, we've not only launched, we purchased the cardiovascular package. What it's brought is everybody together, actually. You can split out the Health Aware program into the cardiovascular service lines, and it makes everybody work together, which I hear a lot, that there's a lot of split between departments, and this pretty much gets everybody on the same page and makes them realize that they're all the same patients. So what it brings to the hospital is every department scratches each other's back, and you maximize the ROI of the patient and prevents them from falling through the cracks. I work very closely with the nurse navigator at our Women's Imaging Center, and people love her, love to hear her speak, so I thought, why can't I just jump on her train? So we got together and threw around a few thoughts and made me develop a program called Hearts and Parts. And initially it was just chest pain or breast pain. So you can talk to the breast pain group or just the women's group that are interested in breast, but you can incorporate chest pain into that. I know there's a new thought of chest centers popping up throughout the country, and that's a perfect way to educate two service lines. You get more bang for your buck if you maximize the crowd that you do have, so it's very easy to do that. I've had discussions with other departments about the same presentation because parts can end up being not only breast but other things as well. So it's a great way, great thought to incorporate and cross-market different service lines within the hospital. It's so nice to share, to give people ideas, to make them excited about what they're doing, because everybody feels it. You come here and you get refreshed and you have a zillion ideas, and when you get back to your hospital, a lot of them die. But if I can spark some enthusiasm and keep them driven, it's only going to make everything better. I mean, the bottom line is to do what you can in this life. So, I actually was interested in the motivational interviewing. We just obtained a grant from the Office of Women's Health to do a cardiovascular program in the fall, and that's something that we're going to incorporate, is the motivational interviewing, because the grant has to focus on educating not only the physician or the clinical people, but also the community.